same set of rules that we're applying. So what we're doing here in Lancaster and the advice that we'll be giving is the same as would apply across the county. So and something to say now, of course, is that our experience has been that that the vast majority of businesses and the public have recognised the need to follow the rules, and I think there has been some confusion about what do the rules mean. Are these guidelines only guidelines? Can we ignore them? What do they actually mean? And hopefully we'll answer some of those questions today. But it is important that we recognise that the law is out there to protect everybody ultimately. So it is important that we follow those rules. And remember that we're all after the same thing. We want to just see the pandemic as just something that we talk about in history classes in years to come. So what you want to hear today is a number of presentations from our colleagues covering the guidelines, covering some of the controls that you need to think about, and then there'll be an opportunity to ask questions later on at the end. We'll also make this available. We'll record this and we'll make this available for other people to view from the website as well later on for anybody who isn't actually joining us today. So I think that's all I really wanted to say. It is really good news that we are here. It's really good news, and it's positive that things are moving in the right direction. We've got the vaccination program that's really making a difference. We've got the knowledge now that we didn't have at the beginning of this. So we are in a different place. And as I say, I think the cards are stacked in our favour this time rather than against us. But it still isn't the end of the road for us, and we need to be very, very careful. So I think I'll stop now, because what you really need to hear is from my colleagues. I will just switch off, but I'll hand over to my colleagues, who will then talk you through the presentation for today, and then I'll hopefully join you at the end when we look at the questions and the answers. So if I can just thank you all for attending. I do wish you all success with your businesses reopening. I hope that all goes smoothly. And I will now hand you over to my colleagues. So thank you very much, and I hope you enjoy the webinar meeting. Thank you. Take care.
Hi, my name's Sue Salisbury, and I work for Environmental Health here at Lancaster City Council. I'd like to welcome you to this Close Contact Services webinar. We hope that it's going to be informative and bring clarity to you as a recap in COVID secure measures that are to be implemented within the businesses in advance of opening, and also to cover some frequently asked questions in relation to this. And at the end of the webinar, there will be an FAQ session, which if you have any questions, please can we encourage you to type them in the chat box so they can be answered at the end of the presentation. So I'll just get the slideshow up. So again, as Steve mentioned, this is in conjunction with Lancaster City Council, Pendle Borough Council and Preston City Council. So reopening businesses and venues from step 1, which was Monday the 8th of March, and from Monday the 29th of March. So on Monday the 29th of March, all outdoor sports facilities will open, and people can use these venues in a group of 6 people or with members of up to 2 households. The next step, which we will be looking at in more detail, is Monday the 12th of April. Non-essential retail will open, personal care facilities and close contact services will reopen, and indoor sports and leisure facilities will reopen, as well as outdoor attractions. Step 3 is Monday the 17th of May, which is indoor entertainment and visitor attractions, and step 4, which is Monday the 21st of June, will be reopening the remaining settings such as nightclubs and adult entertainment venues, and to lift the restrictions on social contact and large events that apply in step 3. But this is subject to the outcome of events research programme by the government and a review of social distancing measures. Okay, so step 2 of the 4 steps. So we will open no no earlier than Monday the 12th of April, which you will all be aware of, and these are for personal care facilities and close contact services, which can include hair, beauty and nail salons, body and skin piercing services, tattoo studios, spas and massage centres, except for steam rooms and saunas, and holistic therapy, and also tanning salons. So, our introduction for this webinar, there are now many regulations and guidance documents for close contact services highlighting the duties upon businesses to help them remain COVID secure and compliant. But with this in mind, you must always ensure that you remain up to date with all current restrictions on your businesses by visiting your local authority's website, as well as gov.uk. Also, all premises have a legal responsibility to undertake a COVID secure and health and safety risk assessment and implement suitable control measures to prevent the spread of COVID-19 between employees and their customers. And guidance on the requirements for reopening of the premises is aimed at before, during and after procedures which should be in place. So before opening, we would expect you to have in your businesses a fully functional risk assessment, which is COVID related, a premises layout where you would be checking for every aspect of your premises, including water checks and health and safety checks, a fully functional cleaning schedule, signage and communication, a QR code that should be in place, appointment booking systems, employee training and personal files, which are always kept up to date, employee PPE and client questionnaires. So the way of working and delivering services to your customers has changed and been adapted to protect the health and safety of both employees and customers. The following must-haves and recommendations should be introduced in aid in the minimisation of any contamination risks. And all of these points will be covered in the following slides with recommendations in place to follow to ensure minimal risk factors. So to start with, we're going to cover fully functional risk assessments. So your risk assessment should include a walkthrough assessment for each area and activity of the premises, hand washing, sanitising facilities, cleaning and sterilising of equipment, ventilation, required PPE, any exemptions and LFT testing. So the most important factor for any close contact service premises is the safety of the customers and the staff. It is imperative that you remain meticulous in making sure all premises are as safe as possible. Via this, you can use various control methods and they must be put in place and fully documented to reduce the risk from coronavirus. With this, each employee should consider their own unique circumstances and tailor the control measures to suit your business needs and requirements. So regular hand washing, we all know that you should wash it to the happy birthday rhyme of 20 seconds. Also the use of antiviral and antibacterial soaps and means of drying. Paper towels and hand dryers are perfect for this, as well as the use of a hand sanitizer that must be readily available for all to use. Consider adding touchless automatic hand sanitizer dispensers. This is only a recommendation. If you can put them in, all well and good. If you can't, then just ensure that because people are using, well, should I say different people are using the hand sanitizers, they will still need to be wiped down. Thorough cleaning at all stages of all activities, and the use of mitigation measures which can include protective screens at the reception area, basin area and workstations, and between sections that are less than 1 metre apart. So for PPE, this can include disposable face coverings, single-use aprons and gloves if required. So the face coverings, visors and goggles for employees and face coverings for customers. So with regards to wearing face coverings, you should also wear a visor or goggles, so you're wearing the two together. Exemptions for non-wearing of face coverings can be due to various reasons for not wearing a face covering, and with this in mind, your customers do not need to routinely show any written evidence of this or an exemption card. This means that you do not need to seek advice or request a letter from a medical professional about your reason for not wearing a face covering. However, some people may feel more comfortable showing this, and a card or a badge that states they do not have to wear a face covering for one reason or another. If employees are exempt from wearing a face covering, this could be a risk factor in working in close contact and proximity to your customers, which should be discussed with either the manager or the owner of the premise and a plan implemented to minimise risks. If the customer is exempt, this will fall to the manager or owner of the business again, and it is up to them whether they allow them on the premises or decline their business, which the latter is highly recommended just due to the risk factor. For downloading and displaying the Staying COVID-19 Secure poster, this is on our website and should be on other local authorities' websites. So we advise you to download it and stick it up around the premise. Also, with regards to your staff and all your employees, you can also offer them for a lateral flow test, which they go and take the test. It's a quick and easy way. You could send them off to it, or you can have them in the house, but we do recommend that, you know, this could be something in place within the risk assessment. And you can also read the government advice for employers to help you complete your risk assessment, as well as looking at the guidance on the government website for sector specific advice for your businesses. So moving on to the premises layout, we recommend that you undertake a thorough review of the premises and the services that you offer. Could they be altered to ensure social distancing with and without mitigation? What about your waiting areas, if used and big enough premise? Reception and treatment areas to adhere to social distancing guidelines as well. And also in relation to your treatment areas, can these be screened off, marked out by tape, or removal of furniture to allow social distancing? So with regards to the premises layout, so obviously we have been through this before. What you need to do is ensure that you are minimising any risk whatsoever. So for your premises layout, your water systems will need to be also checked due to the potential Legionella contaminant, and they should be left to run, which is the hot tap, to a temperature of over 60 degrees for 5 minutes if they've been stood still for quite a while. And also cleaning and soaking of shower heads, etc. in disinfectant to again minimise that risk. Do your health and safety checks. They should be completed to ensure that all electrics and electrical equipment and gas fittings are working, fire extinguishers are in date of service, and the layout of the premise should be organised to allow for social distancing in between the work statements, as I made that comment before, and customers to minimise the risk of contamination. And if where possible, allow the premises to flow in a one-way system. But this is only if your premises is big enough to do that. So you may have a back door so they could enter through the front, exit through the back. Again, we do recommend this, but if you've only got one door, then that's fair enough. Just ensure that there's no crossover when entering and leaving. There's always the use of movable barriers, which can be implemented for mitigation purposes and should be easy to clean. Chairs and work areas can be removed or taped up to demonstrate that they're not in use, and tape can be used to mark off work areas for social distancing purposes. Various hand sanitising stations around the premise for ease of access. So again, all these factors will relate to you having a COVID secure premise. So also having a COVID secure premise, we need to introduce a thorough, robust cleaning schedule. So cleaning and disinfecting should be documented on a schedule to ensure that all employees are aware of their responsibilities when cleaning to minimise the risk, what products and materials to be used and how to use them. So all implements, non-porous, being used on more than one customer must be cleaned and disinfected for the full contact time advised on the antiviral disinfectant label before being used again. Stations, chairs, trolleys and other storage areas should be disinfected throughout the day to ensure vigilance. And antiviral sanitisers are highly recommended with a short contact time, which is around 30 seconds for frequent use areas. There are other antiviral sanitizers that have a 5-minute contact time. We recommend that these are used if your equipment or areas are not going to be used for a long period of time. Also, you can hire fogging machines to ensure that when your customers have left and before you open again in the following morning, the fogging machines can be used. Also, hand sanitizing stations. So with your full cleaning schedule, this should be introduced and to include what we require to be cleaned and what materials and the frequency, with training provided for all employees. During visits to businesses carried out since the beginning of the pandemic, we have observed some general confusion about the organism COVID-19, what it is and what suitable disinfectant will kill the organism. We've also found in many cases, although the product is suitable, the instructions for use are not being followed and consequently the product is ineffective. The virus is capable of surviving in the environment on surfaces, for example, wood, plastic, glass and cardboard, from between 24 hours and 9 days. Therefore, regular and effective cleaning and disinfection is crucial in the control of this virus. When looking for a suitable product, if the product includes mentions of compliance with BSEN 14476, which is the British standards, this confirms the product to be effective against envelope viruses such as the coronavirus. Products must be used at the recommended dilution rate and contact time to be effective. A lot of these products do actually come pre-diluted, so recommend them as for ease of use. These virucidal products should be used in high traffic area to mitigate any risk of transmission of the disease. So with your workstations, these should be cleaned on a regular basis before, during and after the customer. The floor should be swept on a regular basis and all chairs and seating areas must be wiped down with antiviral products, or you can also obtain the antiviral wipes which do exactly the same job. Shelvings where tools and equipment are placed must be cleaned of debris and wiped down with antiviral products and or the wipes. All equipment must be cleaned and disinfected between clients, always referring to the instructions for the equipment and the cleaning chemicals. Also ensuring sufficient time is allowed to clean the workstations before clients. And due to the cleaning times, it's best practice to have more than one set of equipment for each employee. So moving on to signage and communication. This is paramount that signage is used to inform all your clients what the premises requires, and whilst on entering and whilst also on the premises. So these can come in different shapes and format, but as long as you are getting the information across to your customers, that's fine. So the use and implementation of signage will inform your customers of what is required of them and to understand when entering, during and leaving the premise. So update your company website and your social media sites that you use. And when a booking is made, send them a copy of your expectations via email or text. Speak to customers on entering and remind them of these expectations for your business, pointing out the key notices. And there is also a legal requirement for face covering signage. So again, this should be, with your face covering signage, it should be paramount on the door so everybody can see it. Also, the QR code. So the NHS QR code posters are a quick, simple and secure way for visitors to check in and register that they've been on your premises. Use this service to create a QR code for display in your venue, as this is a mandatory requirement. Get visitors to scan the QR code when they arrive using the NHS COVID-19 app. This is to help trace and stop the spread of coronavirus. So taking part in the NHS Test and Trace became mandatory from the 18th of September 2020, which is to keep a record of all clients visiting your premises. When the clients visit, remind them to scan the code displayed at the premises, and this can be on the entrance door, reception, surrounding work areas, walls, etc. And by using the NHS COVID-19 app, it helps trace a lot of people quicker than it would be just by taking the details. So if you don't have the app for any reason, full details should be documented for all clients and should be kept for 21 days. The app also collects information of when customers arrive and leave, so it makes it easier for tracing purposes. Moving on to the appointment booking system, we kind of recommend that this should be implemented so that you can keep a track on people coming onto your premise at all times. So all businesses activities recommended by appointment only. Walk-ins should be discouraged. Staggered times to allow for cleaning in between clients. Clients could receive a text or an email asking to confirm their appointment before their arrival, to arrive at the premises at the allotted time, and a wellness questionnaire could be put in place to be completed before or upon arrival. So to ensure that all employees' appointments are booked with consideration of what the required activity is to allow time before and after the cleaning, etc., as well as work areas with the premises. This may be hard to manage, but should be encouraged amongst the team. So again, this is something that you may already have in place or looking to put in place. Okay, moving on to employee training and refresher training. So this is to provide a clear, consistent and regular communication to improve the understanding and consistency of ways of working, including updated guidance. Engaging with employees through existing communications routes to explain and agree any changes in working arrangements. Developing communication and training needs for employees, old and new, prior to returning to work, especially around new procedures for arrival. Ensuring employees understand how to use, store, clean or dispose of their PPE. So again, all staff must be trained in all new procedures, whether they are COVID measures or industrial protocols or procedures. And it's a good idea to go through the written COVID assessment that you've implemented within your premise and to discuss through the risks and control measures that have been implemented for full understanding and also to be fully documented for audit purposes. We also recommend that all employees' personal files must be kept up to date, including all relevant risk factors and training in relation to COVID and the COVID secure measures that you are putting in place within your business. So with regards to employee PPE, so the person providing a close contact service such as hairdressers, etc., must take precautions due to the period of time spent in close proximity to a person's face, mouth and nose. This must take the form of a clear visor or goggles and a type 2 face mask. Single-use aprons, gloves, gowns, etc. are all recommended where possible. So again, a visor or goggles and a type 2 face mask must be worn at all times by all employees, and a face covering must be worn by the client. We also, when we were out and about after the first lockdown, we did notice that a lot of people who were in salons, etc., were wearing a visor with a face covering, i.e. a mask, but the mask was under the chin. You've got to ensure that your mask is fitted properly on your face. You clamp the top of the nose to ensure that it stays there, and it also to cover your mouth and chin. Recommendations are to wear disposable aprons, coveralls and gloves if you're required to wear them, and they should be of single use, which should be changed between clients and disposed of correctly, i.e. in a waste bin. If wearing gloves, they should be single use, and hands should still be washed in between changes. Businesses and premises that fail to ensure that the correct face coverings are used by staff and customers, i.e. a visor and a mask, can be served with a fixed penalty notice and or prosecuted if this is prolonged. So, as I touched on client questionnaire before, these can be implemented as a measure to identify an individual that may be a risk factor, and the questionnaire should be designed in a simple format but effective enough in relation to COVID-19. So again, these can includes some simple questions that are: have you developed a cough or a sore throat in the last 24 hours? In the past, have you had any contact with anyone experienced the above symptoms? In the past 2 weeks, have you had contact with any confirmed cases of COVID-19? Is anyone in your home self-quarantining or under mandated quarantine? Are you currently awaiting results for a COVID test? And do you have any restrictions or concerns for wearing PPE? This could also be completed before the appointment, so this could be actually sent out to your clients when they're making the booking. Ask them to fill it in and ask them to email it back or text it back, or you could also have them fill it in when they come up into the premise. So before and during, so from the appointment booking system, ensure that clients' arrival times are staggered to minimise close contact. So again, with all members of the team, ensure that they have their own booking slot times to avoid any conflict with other colleagues, clients, as well as basing the customer's appointments with what they require. For example, are they coming in just for cut, colour, nail infills, big or small tattoos, or various beauty treatments, because they all take a different amount of time. So bear this in mind when you are actually booking people in. If the clients have any symptoms of COVID, then they should contact the premise as soon as possible and not attend their booked appointment, as well as being reminded of this when booking their appointments. So during your customer's visit to the premises, so when greeting the clients or customers, avoid any personal contact with them and always ask them to sanitize their hands on entry. So ask your customers to arrive at the premises entrance at their allocated appointment time and ask them to arrive alone unless they're accompanying a child and with limited belongings. The last thing you want is somebody coming in with bags and bags of shopping with nowhere to store them. Greet the customers at the door for a temperature check if this is something that you have in place or you have noted down on your risk assessment. Ask them to sanitize their hands before being seated and to complete the wellness questionnaire if this has not been completed beforehand. Pens can be provided as long as they're sanitized after use. Face coverings should be worn at all times by your customers unless being required to be removed for the completion of a haircut, for example. Place their coat belongings in an individual plastic box or bag away from the treatment area, again to minimise the risk factor. And there should be no reading materials on view for customers, but they are allowed to bring their own. If you are going to offer refreshments, this should be in a disposable cup, or they may bring their own bottle, but no food is allowed. Again, all areas of the premises will be regularly monitored and cleaned, and through thorough cleaning of all equipment and premises owned or personally owned by the employees before and after each treatment, and a pot for general cleaning and disinfection of equipment should be in place. Barbicide or another industry approved product can be used. Thorough cleaning of surfaces such as handles, handrails, light switches, tables, PCs that are touched by many. So it's your main touch points. Laundry such as towels and gowns, although disposable gowns will be a good option, to be washed on a hot temperature following each usage. Please do not reuse a gown that a client or customer has had on before. If using washable gowns, they should be only used once, and disposable capes over the tops of those gowns. With regards to your workstations, again, clean and disinfect all non-porous implements used in the business and required by the government, and to help your own diligence in supporting the health and safety and hygienic premises. So again, immersion of equipment, spray or use the wipes, as long as they are, which we do recommend for each premise, is a sanitizer with a viricide in it. Store properly disinfectant implements in closed containers to remove any contamination. So again, keep them away, out of reach from anybody that somebody else that could pick them up, i.e. one of your colleagues. Clean and disinfect all electrical equipment used in the services and at the contact points. And prior to initial reopening, clean your chairs. Consider barrier methods on chairs such as disposable paper drapes or similar. Also clean and disinfect each workstation, trolley, drawer and any containers used for storage. With regards to your bathroom areas, again, these should be cleaned and disinfected on all surfaces. Replace any soft goods, i.e. toilet paper or paper towels, and make sure that they are fully stocked. Consider upgrading to touchless soap dispensers, which I touched on before. Again, if this is something that you don't think you can install, that's fine. Just remember that obviously a lot of people are touching hand sanitizers if they are not the pump dispenser ones. Also ensure there's a waste bin in the room and remove any products that do not belong in the bathroom. Nothing should be stored in a bathroom that is not needed and that can also be touched or moved. If you have a staff room in your premise, this should be thoroughly cleaned prior to reopening, with all surfaces cleaned and disinfected throughout the day. Minimise staff numbers dependent on the size of the room, and they can be at least 2 metres apart, conforming to social distancing. Staff members to be encouraged to bring their own cups and mugs for their own personal use, unless you want to get them to use disposable cups or bring their own water bottles in or soft drinks. Again, this is just to minimise that risk of contamination. If you have your laundry room, so any linens that have been left in the salon prior to lockdown, clean or dirty, should be washed on a hot temperature with detergent and dried until hot to touch. And there should be no moisture or dampness in any linen once it has been dried. Launder all towels and capes. And all lines should be stored in closed covered cabinets. All linens should be stored in closed covered cabinets if possible until used. And all towels and capes should be laundered after every single use. Again, during your client customer visit, where possible, try to escort your customers straight to the treatment area room to avoid any congestion to the entrance and waiting areas. So again, each customer should have their own fresh gown and towel, and disposable single-use gown is recommended. All equipment should be cleaned and sterilised after use. Washing towels, etc. Again, highlighting that it should be on a hot wash. Some treatments that you may not be able to offer within your premises for a temporary time, so please advise this when customers are actually booking. The client should remove their face covering if their mask is interfering with their treatment. So essentially, the hairdresser or barbers, for example, trimming around the ears or trimming a beard. So intricate detailing, outline or shaving a beard should not be provided at this time. Every customer must remain at their designated section and only be guided to another part of the salon by a member of staff throughout the duration of the appointment. If they want to visit the bathroom, then again, if you can, escort them just to try and minimise the risk of them coming in contact with anybody else that is in the premises at that time. Moving on to payments. Again, for payments, ask that your customers use a card or any cashless means where possible. So when undertaking payments, contactless is the most preferred option. The limit at the moment is 45, but is currently under review to be raised. But they can also use the keypad when inserting the PIN, as this can be wiped with your sanitizer, well, your antiviral sanitizer and or wipes. And if taking cash, ensure that you wash your hands immediately after. And this can be also discussed during the booking of the appointment. At the reception, we recommend a protective screen that should be in place, must be in place between the client and the till. Again, you're minimising that risk. And if the client is interested in purchasing any retail products, a member of the team should assist with this. I wouldn't advise on giving appointment cards out. Just try the electronic method of either text or email. And again, for future appointments, confirmations, because it's easier and you're not actually physically touching anything. After the revisit process for before and the customers enter the premises, which include, so you're going to revisit all your cleaning steps from your cleaning schedule and re-implement them before you receive another customer. So that would include cleaning of all materials and equipment, including all touch points. So whether that be your till, your phone, the light switches, chairs, tables, workstations, shelving, utensils, equipment and floor. And don't forget your floors, because that obviously with hair falling on, get it brushed up as soon as you can. Wash hands on a regular basis, sanitize your hands, restock so you're not wandering around looking for items, and highly recommended use single-use gowns, gloves and face coverings. Okay, so I've come to the end of my section on the webinar. So thank you for taking time to log on for this webinar, and we hope that you find the points raised useful when preparing for reopening. I will now hand you over to my colleague Laura for your questions. Thank you very much for joining.
Hi everyone. Thank you very much for that, Sue. Hopefully everyone can take something from that presentation. As Steve said in the beginning, this is not reinventing the wheel. It's just maybe tweaking your risk assessments from last year, making sure that they are all up to date, making sure your client files are all up to date and your personnel files are all up to date. Okay, so we have a few questions that have come in during the presentation. One of them concerns lateral flow testing, an excellent way to get your staff to have that confidence that your staff are not suffering from COVID without knowing. One of the questions was, where do we get hold of these tests? Now, I work from Morecambe Town Hall, and I know here we are offering the service, but the best thing to do is to contact your local council and ask where you can get hold of the lateral flow tests. If you go on .gov.uk lateral flow testing, you can pop in your postcode there and it will show the nearest point where you can pick some lateral flow testing kits up, or you can go and have a physical test done, maybe at a council building. So that's the best thing to do in that situation. We've also had a question in concerning the training of staff before the reopening date. Now, I believe this was answered by Steve during the meeting, but basically any commercial hair salon can continue to train their staff on the premises, but the important thing to remember is that no members of the public are allowed on the premises, so you can't use members of the public for training purposes. Again, commercial training salons can still provide accredited training, but only to each other or to their training provider, not to members of the public. Accredited training providers cannot also run off-site courses, so they must continue to do the training where they would normally do that training. We've had another question regarding interventions that will take place by ourselves and by the police. We know that there are people out there flouting the rules. Okay, we've seen it, we've come across it here in Lancaster, and no doubt it's elsewhere as well. What I would say is we have a range of different interventions to be able to tackle any complaints that we do get into the service, and that might include fixed penalty notices, or even up to prosecution if it's a long-standing complaint. What I would say is we take a risk-based approach to this. We see if there's any complaints, we give the advice, and if the law is being broken, you know, the advice is being ignored, then we will take that on board in deciding what to do. So what I would say is any premises that you think are flouting the law, just report it to your local environmental health office, and they will take it from there. It's not fair, it's not right. There needs to be a level playing field out there. So it's important for anybody who is flouting the rules to receive some sort of intervention, whatever that may be. So I do encourage anyone to report that through to their own office. Okay, I had another question through about client questionnaires. Is 24 hours sufficient enough time? Yes, yes, I believe so. So long as you're getting that information before clients are attending the salons or the close contact premise building, whatever it may be. So that's fine. That's enough notice. Right, masks. Okay, so do customers have to wear masks? So the basic short answer to that is yes. Okay, by law, customers must wear face coverings on entering close contact premises. This must be kept on until the customer leaves. It can be removed for short periods of time, such as having a beard shave or close work around the face, but the time that the mask is kept off should be as short as possible. So the way to remind customers that this is a requirement is to put signage on the door to tell people that they must wear face coverings before entering at the appointment booking stage. Now, there are some circumstances when customers are not permitted to wear a face covering. This is not automatically obvious. It can be due to age or health or disability reasons. Now, you can politely ask to see evidence of this. However, you can't insist on seeing evidence that somebody is medically exempt. And also, customers do not need to provide evidence of this. Some customers feel like they like carrying around evidence of this, and that gives them a more confidence to be able to say, look, I don't have to wear a mask, but you can't insist on seeing it. So it's up to you as a business to decide whether you are comfortable in seeing clients who are medically exempt. What I would say is, if you do decide to see customers who are medically exempt, keep the appointment as short as possible. So unfortunately, no long colour treatments or no long tattooing. I know it sounds antisocial as well, but try and avoid conversation with the client as you're working on the hair or other options. And again, spot checks are done by environmental health, and also the police are responsible for ensuring that customers are wearing face coverings. And what I would say again is we would consider any complaints that come into the service and obvious signs that this is not being adhered to. If there's one customer in the salon without a mask, then you know that it's obvious that that person might be medically exempt. However, if there are a bunch of people in the waiting room, none of them wearing masks, then further action would be required to be taken in that situation. Right, I have a member of staff who refuses to wear PPE. So as an employer, there's a duty on you to protect the health and safety of your employees. So in deciding whether the health and safety of employees has been considered, then we would look to the government guidance here. And that states, as Sue has previously mentioned, that a type 2 face mask, visor or goggles must be worn when in a close contact with a client. This is to protect your staff and also to protect customers. Studies have shown that wearing the correct PPE can reduce transmission rate by up to 80%. So again, I know it's it can be awkward. I know it can be difficult to see, especially close work. I know it can be uncomfortable, but at the end of the day, this is wearing the right PPE would protect you. It's protecting your customers, and it's what we have to bear in mind during this pandemic. Safety is paramount. Okay, as Sue mentioned, a new mask between every client, and also a changing of the masks if it ever becomes moist or damaged. If a member of staff is medically exempt, then really should be considering whether they shouldn't be working within the close contact of a customer. So as part of your opening checks before the salons are allowed to get open the doors and get the customers in, identify with any members of staff whether they have any medical issues which stops them from wearing the appropriate PPE. Right, if a member of staff is refusing to wear a PPE without your knowledge, so first and foremost, make sure that all employees are aware of their responsibilities. They know that they need to wear the PPE. It's a good idea to get this, to get each member of staff to sign off the risk assessment, to say that they understand what the correct PPE is that they have to wear. It's not good enough just to say, right, you have to wear this PPE and that's it, and no monitoring happens after that. As an employer, as a manager, this needs to be closely managed. If you are off-site, then this needs to be delegated to another member of staff to make sure that employees are wearing the appropriate PPE. I'm not going to get into employment law at this stage, but employees have a duty to look after their own health and safety and cooperate with managers. And if they refuse to wear the PPE and they've been advised and they've signed the risk assessments, then disciplinary action could be considered at that stage. Other frequently asked questions: can I wear a homemade mask or a material mask instead of the type 2 masks? So basically, the short answer to that is no. The type 2 masks have 3 ply layers to them. One of the layer is a waterproof layer, which is sneeze proof. So they really are the blue and white sort of surgical masks that are common are the best masks for the job. So another question that has come in concerns outbreaks in the workplace. So what to do in the event of the worst comes to the worst and you have an employer who has tested positive, or indeed you've had a customer that's been into the salon that has tested positive or is showing symptoms. So I'm going to try and put a link onto this system afterwards, and it's a consultation document. It's produced by Public Health England. It's available on their website. So if you just go to Google and tap in Public Health England workplace guidance document for coronavirus, you'll be able to find it. It's a very user-friendly booklet with easy to follow steps, and you'll probably find that booklet answers a lot of the questions. But first and foremost, all members of staff should be aware that if they develop any symptoms, it is important to tell their employer as soon as possible. Okay, so if a member of staff reports having symptoms, they must be sent home and they must start the self-isolation period of 10 days. During that period, they can be asked to do a test. If the test comes back negative and they no longer have the symptoms, then they are okay to come back to work. However, if the test comes back positive, then the manager needs to identify as quickly as possible any close contacts that member of staff has had during their infectious period. So if a member of staff was to start showing symptoms on, say, a Wednesday, the infectious period is 48 hours before symptoms start. So a manager needs to identify any close contacts that member of staff has had the Monday and the Tuesday. Okay, and any close contacts will have to also self-isolate. This is a positive test result. So any close contacts to that positive test result will have to self-isolate for 10 days. And this is whether or not there has been that close contact has received a negative result from a COVID test. And the reasoning behind that is symptoms can still develop up to 10 days afterwards. So it's important to maintain that self-isolation period. So what is a close contact? Close contact is a household contact. So that's maybe relevant if you're working with your household members. It's any face-to-face contact of less than 1 meter if there has been coughing or if there's been conversation. Or it's face-to-face contact under 1 meter for 1 minute or more. So basically, if you have been doing somebody's hair, if you have been doing a tattoo, you will be classed as a close contact. And this is whether you have worn PPE or not. If there's a single case reported to the salon, then there's no need to report this to Environmental Health or Public Health England. However, 2 or more linked cases will need to be reported to the Public Health England Contact Tracing Hub. Okay, so I've got the telephone number here, but it should be available on the website as well. The number is 0344 2250562, and that's option 9. They will run through with you lots of questions concerning who the close contacts are, and they will need up-to-date contact details of members of staff who are classed as close contacts. So this is why it's important to have your HR files on each member of staff up to date before you reopen, so you have that information there at hand. Now, if you have also, sorry, I should say that it's important if you do have anybody who has tested positive within the salon or the any other premise, to have a thorough clean down, a clean sanitisation of everything in store. But you do not have to close down. You can carry it on as business so long as this has been closely monitored. If a customer has reported that they have been in the premise with and they have been had a positive test for COVID, or they've started with symptoms and have subsequently tested positive, then other customers will not need to be informed so long as your premise is COVID secure. So if your customers are kept at 2 meters apart from each other, and the process has been closely risk assessed, then there's no need to let other customers know. However, any member of staff working on that customer who has tested positive will need to self-isolate for 10 days because, as previously stated, they will be classed as a close contact. Question coming about ventilation. So it's important to keep the salon, the premise, well ventilated. Keep that fresh air coming in, so windows and doors to be kept open. Hopefully the weather's getting a little bit nicer now, so that shouldn't be too difficult to do. A poorly ventilated, occupied space poses a much higher risk of transmission. So ensure that good ventilation is going through the salon. You're saying keep those. Right, I think that's all of the questions that have come in before the session. I'm just making sure. Oh, yeah, a question concerning toilets. Of course, you're going to get customers there that are going to be spending a large amount of time within the salon. So you don't have to close your toilets. Just what I would say is make sure that they are cleaned regularly. And also another question that was sent in surrounds alternative therapy workshops. Can these go ahead? And concerning, are there any grants available for funding things such as becoming COVID secure or towards PPE? What I would say is check with your local council for what grants are available. I know the latest grants for the latest lockdown, the system closes at the end of this month, so it's important to contact your local council, ask them to put you in contact with the business support department to see what potentially what grants there are available. But I know there is some money to be spent on the outlay of things such as PPE and maybe the screens. But there are ways around, not the PPE, but the screens. If you keep customers more than 2 meters apart from each other, if you only have one customer in at a time, there are ways around being able to avoid putting the screens up, and that's maybe, give you the option to reduce the cost of ensuring that your premise is COVID secure. Okay, I'm just having a look at any other questions that has come in. So, member of staff who is pregnant, classed as vulnerable. So I would say it's important to discuss with the member of staff before work is started back as to whether she can wear the PPE. If there's not a problem with her wearing the correct PPE, then that what I would say is during the course of working, if you can make sure that any members of staff, not just the pregnant ones, but any member of staff is given frequent breaks. They are given the chance to leave the salon, have a walk, take in some fresh air. Maybe think about extending the hours of the opening hours to allow customers, more customers in over an extended periods of time, to give staff members chance to take frequent breaks. The wearing of the PPE is whilst you're within close contact of a customer, so maybe you can have a little break from wearing the PPE if you're in the office, or sweeping hair, so long as it's away from customers, or on the front desk if you have a screen that's up at the front desk. Okay, I'm just looking for my colleagues passing me questions as I'm speaking, so I'm just bear with me then, just having a look to make sure we've got everything. What are fogging machines? So these are machines that can be used to quickly sanitize areas. They're used quite frequently in places where there's a lot of customer throughput. So I would say if this is something you are going to look at doing, just ask the company who provide the machines whether that's the cleaning chemicals are used adequate for killing viruses. Okay, and Sue mentioned before about the contact time of cleaning chemicals. Now, the contact time is the time it takes a chemical to work before it kills the virus. So check the back of the instructions on any cleaning chemicals to make sure that that contact time is being adhered to. We see quite often, not just in salons and other premises, but also in our food businesses, where sanitizer is sprayed and then wiped straight away, and you're not giving chance for the sanitizer to work and to kill the virus. It needs to be left on for the correct amount of contact time. The shorter the better. So the best contact times out there are 30 seconds, but the more commercial products that you will find on the shelves can range from 3 minutes up to 5 minutes. Okay, so has anybody else any questions that they would quickly like to put into the chat box? Okay. Right. Okay. I believe Steve wants to close the meeting off now. I would say if anybody does have any questions afterwards, just contact your local environmental health office. We are here to assist businesses in this process. So don't be hesitant in giving us a call and just running through something. Okay, so I'm just going to pass you over to my colleague Steve just to close the webinar. Okay, thank you very much.
Yes, thank you, Laura, and thank you, Sue, and thank you, Janice, as well. You've all done a fantastic job there, and thank you everybody for attending. I noticed we had, well, I think it got up to about 100 people there that were actually on the meeting, which is fantastic. It does make it a bit difficult to try and manage all the questions that are coming in. I think Laura's done a very good job there to try and deal with them. But we recognise that we won't have answered everybody's question. And I can still see questions are popping up. Some of them are very specific, some of them more general. We will do our best to make sure that every question that has been raised will get answered, and that message will get back to you all. But I'm also recognise that we don't necessarily have everybody's email address, so we need to think of a way of getting that message back to everybody. So as I just said there in the chat, that at the end of this event, my colleagues will look at the questions that have come in, make sure that we've answered all of those the best that we can. We'll share that information with our colleagues across the county, because this, of course, is a Lancashire-wide webinar that we're on at the moment. So as you've heard several times so far, keep in contact with your own local authority. We'll make sure that they are aware of the questions that have come in, and make sure there is a consistent response as well, because again, you know, we're talking from a Lancaster perspective, although we've worked closely with lots of colleagues across the county in the environmental health teams. So we'll make sure that it's consistent. I think that it's been so great that people have taken the time to join us, and I just hope that we've given you some direction and some advice really in the preparations that you'll be going through in getting ready for the 12th of April grand reopening. As I said at the beginning, I think we are much more positive now than we have been in previous lockdowns, that, you know, we would like to be able to see the back of COVID. I think that even after the 21st of June, I think generally we all recognise that there will still be some question about how do we manage COVID going forward? Do we end up having an annual booster vaccination as we do for seasonal flu? There's lots of things to be thinking about. I've also picked up on some of the questions that have come through about changes, advice around face coverings, face visors, whether they're necessary, whether they're advisory. I think just we have to recognise that nobody was expecting to be faced with COVID as we have done. Nobody was expecting it to go on for 12 months and longer. And I think we just have to bear with the guidance, trust in the science that we've got, trust in the advice that's being issued, stay firm to that advice, and then hopefully we then will see further relaxations and no need to put us back into any sort of lockdown in the future. And then there will be time after all of this for us to look at what worked and what didn't work, so that when or if there is a further problem, who knows when, then we would have learned an awful lot from the last 12 months. We will know what will work and what won't work. And we recognise how difficult it can be to manage your own staff and also manage customers as well as they're coming into your business, because everybody wants to return to some sort of normality, and hopefully that will happen soon. So rest assured, we'll do our best to finish off with answering as many of the questions as we possibly can. We're happy to field those questions coming in to us, and we will continue to take that. And then we will share that with colleagues across the county, and we will add it to our website, which is Lancaster City Council's website. And then we'll share that information with other colleagues as well, so they can add it to their own websites. So one way or the other, we will get the answers back to you. So I'll close the meeting now. Thank you very much for attending. I hope you've enjoyed it. I hope it's been useful. Obviously, we're quite happy to take feedback as well as to what's gone well and what hasn't gone well, and whether there's anything else you'd want to see from us in the future if we rerun something similar. So we're happy to do that. So feedback would be much appreciated. So I wish you well, stay safe, and I hope that the opening goes to plan on the 12th of April and that we never have to face this again. So take care, and thank you very much for attending today. Thank you.